Hello, I'm Jeremy Paredes. I am a sophomore in college at Georgia Tech, and I have eczema since I was a baby. And I'm also a National Eczema Association ambassador. Mentally and emotionally, eczema is very hard to deal with because it's very hard to manage it. It's very hard to be hopeful when you scratch, you start bleeding, you get infected, the eczema gets worse, and then you just get itchier. So my eczema hit the lowest of lows in 2020, my junior year of high school, and there were a lot of factors. With my eczema, I was playing sports every day. I was under a lot of stress with school, and my eczema was just continuing to get worse and worse to the point where I was going to several different doctors, dermatologists, trying to seek any type of medication or remedy that would help manage or at least get my eczema a little better. But it just got worse and worse to the point where I was bleeding, oozing, my skin was a mess. And it got to the point where my skin was so bad that it hurt to walk. I couldn't go to school anymore. I couldn't play sports. And I was pretty much debilitated. I was laying on the couch for days on end, not being able to move because my skin hurt so bad. And so February 13th, 2020, my mom kind of looked at me on the couch. I was pretty colorless, motionless, skin was really hurting, and she took me to my pediatrician, and my pediatrician doctor took my vitals. They were extremely low to the point where they couldn't even read them, and my pediatrician decided to send me to the ER to make sure that everything is okay with my body. She had a feeling that something wasn't right, and so when I got to the ER, they took my vitals, they stabilized me, and they told me that I was in septic shock. And so the explanation for the septic shock was that because of my eczema, there were so many open wounds that infection got into my bloodstream. For me, having a lot of allergies, I would react to all the topicals or steroids that they would give me. And some of the dermatologists that we went to, when we told them, hey, we can't use medication A or medication B because I've already had a reaction to that, they wouldn't listen. They would just double the dosage, saying that I just need more of it to get better. And so I think having a dermatologist who will listen to you, give you input, ask your opinion about certain medication, and then work with you to come up with a plan that's unique to you is very important. My dermatologist now, he is amazing. His name is Dr. Cox, but he was the first dermatologist who listened to my mom and I, who told him that this medication I had a bad reaction to and that we can't use it anymore. And it kind of opened his eyes to trying to find new remedies that work specifically for me. Maybe it didn't work for his other patients, but for me, because I'm a special case, every patient is a special case, that maybe this different medication would work for me. So I think having a dermatologist or doctor or provider who understands that one medication isn't the solution for every patient, and that they need to kind of think outside the box and kind of take every patient as a unique subject, as a unique problem, is very important.